Okay, so think about this. Your toothbrush. Is it just for polishing your smile, or could it actually be like a key part of your body's defense system?
It sounds a bit dramatic, maybe.
Yeah, maybe a little. But what we're seeing in this deep dive, looking through all these sources, it really seems like your mouth is this incredible early warning system for your overall health.
It really is. It's a fundamental shift in how we should think about it.
We're talking about how ignoring something like gum disease isn't just, a dental problem. The science is showing it's a major risk factor for huge things: heart disease, diabetes, even cancer, and cognitive decline.
Exactly. For so long, medicine kind of treated the head and the body as separate things. But what the research clearly defines now is this deep, often critical two-way connection, a bidirectional relationship, as the sources put it.
Between oral health, specifically chronic gum disease, periodontal disease, and these really serious systemic conditions.
Yes, and the vital link, the thing connecting them, seems to be chronic inflammation. And diet plays a huge role in either fueling that inflammation or helping to control it.
So our mission today is really to unpack the biology behind that, show you how it works, and give you some, real knowledge you can use.
Actionable knowledge to protect yourself, absolutely.
Okay, let's break down that two-way street idea right away, because that feels really important. The research says poor oral health drives inflammation elsewhere in the body.
Right.
But things like diabetes can also mess with your mouth's health, making infections easier to get and harder to beat.
That's the loop. It's a really vicious feedback cycle in many cases.
So where do we start? Defining the main culprit.
Yes, let's define the threat. Periodontal disease, or PD. And just to be clear, this isn't just a simple cavity. It's a chronic, kind of slow-burning inflammatory process in your gums.
It starts small, right? Like gingivitis.
It often starts as gingivitis.
Yeah.
That's the initial stage, just minor gum inflammation, maybe some bleeding when you brush. But if you don't deal with it, it can progress to periodontitis.
And that's the serious stage.
That's the serious stage. We're talking about actual destruction of the tissues that support your teeth. The gums, the bone underneath, the ligaments holding the tooth in place. It's structural damage.
Wow. And you mentioned this is incredibly common. The numbers were pretty staggering.
They really are. We're not talking about some rare condition here. One review we looked at estimated that PD affects somewhere between 40% and, get this, 90% of people worldwide.
40 to 90%. That makes it one of the most common health issues on the planet.
Easily.
Yeah.
And if that many people have this chronic inflammation starting in their mouths, well, it has to be having wider effects, right, too?
Yeah.
Which brings us to the key question.
How does an infection in your gums actually travel? How does it cause problems elsewhere?
Good question. There are two main ways this happens, and they're related. The first is what we call systemic inflammation.
Okay.
Think of your inflamed gums like a leaky faucet, constantly dripping inflammatory signals into your body. As your immune system fights that chronic infection in your mouth, it's continuously releasing these chemical messengers, these pro-inflammatory proteins, into your bloodstream. Things like interleukin-1, TNF-alpha, and crucially, C-reactive protein, CRP.
Wait, CRP? I know that one. Doctors talk about CRP levels regarding heart disease risk, don't they?
Exactly. CRP is a major marker. Your liver pumps it out when there's significant inflammation anywhere in the body. So with chronic gum disease, you can have persistently elevated CRP levels.
So it's like your body's emergency alarm system is constantly switched on, even if the fire is just in your gums.
That's a great way to put it. It creates this low-level chronic inflammation throughout your entire system. The body's always on high alert.
Okay, so that's one way, the constant inflammatory signals. What's the second mechanism?
The second way is even more direct, microbial dissemination. Basically, the bacteria themselves and their toxic junk get into your blood.
How does that happen?
Well, inflamed gum tissue is really rich in blood vessels. It's highly vascularized. This makes it surprisingly easy for the specific bacteria causing the gum disease and their byproducts to just slip right into the bloodstream.
So these bacteria are literally hitching a ride through your circulatory system.
They are. And not just the bacteria, but also their waste products, like something called lipopolysaccharide, or LPS. Think of LPS as toxic bacterial exhaust.
Okay.
These bacteria, especially gram-negative ones, and their LPS get into your blood. And once they're in there, your circulation becomes like a superhighway for them.
Letting them travel anywhere.
Pretty much. They can travel to distant organs and tissues and start causing localized problems far, far away from your mouth.
Okay, this is where it gets really critical for you, the listener, because now we can connect this inflammatory highway and these traveling bacteria to some of the biggest health threats we face.
Absolutely. Let's start with perhaps the most established link, and it's that perfect example of the two-way street, diabetes.
Right. You mentioned that connection earlier.
Yeah. For a long time, periodontal disease was just seen as a complication of diabetes because people with diabetes are generally more susceptible to infections and their healing can be compromised.
Makes sense.
But the really crucial discovery, the game changer, is how it works the other way around.
Meaning the gum disease affects the diabetes.
Profoundly.
Mm.
Periodontal disease makes it significantly harder for people with diabetes to control their blood sugar levels.
How?
Remember those inflammatory proteins we talked about, CRP, another one called IL-6? They're directly associated with increased insulin resistance.
Ah, so the inflammation from the gums basically interferes with how the body uses insulin.
Exactly. It's like background static that stops the body's cells from hearing the insulin signal properly. This dramatically increases the risk for serious diabetic complications, kidney problems, nerve damage, eye problems.
So suddenly, a visit to the dentist or hygienist becomes a critical part of managing diabetes.
It absolutely should be. It reframes the whole priority of oral care for diabetics.
Okay, if inflammation is the key link, then the heart and blood vessels must be next on the list. We know chronic inflammation is terrible for the cardiovascular system.
Spot on. The research consistently links PD to a higher risk of several cardiovascular diseases, heart attacks, clogged arteries, atherosclerosis, and stroke.
How much higher? Are there numbers on that?
Yes, and they're significant. Some sources indicate that having severe periodontal disease could increase your functional risk of cardiovascular disease by anywhere from 25% up to potentially 90%.
Wow, 25 to 90%. That's a massive risk factor that most people probably aren't even thinking about.
It really is. And it's not just about the general inflammation. Remember the bacteria traveling.
Right, the microbial dissemination. Is there proof they reach the heart or arteries?
There is. This is fascinating. Researchers have actually found the DNA of periodontal pathogens, the specific bacteria from gum disease, physically embedded inside carotid artery plaques.
Inside the plaque that clogs arteries.
Exactly. The same bugs causing trouble in your gums have traveled through your blood and literally set up shop in those fatty deposits in your arteries.
That's incredible.
And systematic reviews back this up. They show gum disease increases the relative risk for coronary heart disease by about 20%, and the odds of having plaque in your carotid arteries by around 27%.
Okay, so we have inflammation and actual bacteria damaging the heart and vessels. What happens when these inflammatory signals and bacteria encounter cells elsewhere that might already be under stress or maybe starting to mutate? Does this connect to cancer?
This is where some of the numbers are, frankly, quite shocking, especially looking at data cited for men. One source linked gum disease to a 49% higher likelihood of developing kidney cancer,
49%.
a 54% higher likelihood for pancreatic cancer, and a 30% jump in the odds of developing blood cancers like leukemia or lymphoma.
Those are huge numbers, but I have to ask the obvious question. Is this causation? Is the gum disease causing the cancer? Or is it just that people with gum disease might also do other things, like smoke, that cause both problems?
That's a very smart question, and it's definitely where researchers are digging deeper. It's complex. However, even when studies try to adjust for those shared risk factors, like smoking or diet, the association often remains significant.
So there might be a direct link?
The thinking is that chronic inflammation itself can damage DNA over time. And the constant presence of these bacteria and their toxic byproducts, like LPS, creates a stressful environment in tissues that could potentially encourage cells to become cancerous.
Interesting.
And perhaps the most telling finding from the reviews we looked at was the risk for head and neck cancer. Periodontal disease was linked to more than tripling the risk.
Actually,
That strong localized association really suggests that a chronic infection right there in the mouth area could be acting as a major trigger or promoter for those specific cancers.
it really makes you think differently about, seeing a bit of pink on your toothbrush. It's not just minor bleeding. It could be a warning sign for something much bigger.
It's like ignoring the check engine light, isn't it? The problem might seem small, but the potential consequences are huge.
Okay, let's push this connection further. What about the brain and the lungs?
The brain connection is pretty chilling, honestly.
Hmm.
Several studies now link the specific types of bacteria found in severe gum disease to the progression of Alzheimer's disease.
How would that even work?
The leading theory is that these bacteria, or possibly the inflammatory molecules they trigger, manage to travel from the mouth to the brain, perhaps via the bloodstream or even nerve pathways.
And once they're in the brain?
They might trigger inflammatory and immune responses within the brain itself, contributing to the formation of those amyloid plaques and neurofibrillary tangles that are characteristic of Alzheimer's. The numbers suggest PD raises the risk of Alzheimer's and cognitive impairment by about 67%.
67%! That's terrifying. And the lungs, is that a similar inflammatory pathway?
The lungs are actually a bit more straightforward, more mechanical. Bacteria from the mouth, especially if you have a lot of plaque buildup associated with PD, can easily be basically breathed in or sucked down into the lungs.
Ah, so you're inhaling the problem bacteria.
Precisely. And once they're in the lungs, they can directly contribute to respiratory infections, most notably pneumonia. One analysis showed PD increases the risk of pneumonia by a staggering 3.21 times, over triple the risk.
Wow. Okay, and we also touched briefly on risks during pregnancy and for bone health.
Yes, quickly on those. For pregnancy, PD is consistently linked in studies to adverse outcomes like premature birth and low birth weight babies. It seems to increase the risk of preeclampsia, a serious blood pressure condition during pregnancy, by about 43%.
43% risk increase for preeclampsia.
And for bone health, well, periodontitis is fundamentally about bone destruction in the jaw. So it shares mechanisms with osteoporosis, which is systemic bone loss. The inflammation drives bone resorption. PD significantly increases the risk of osteoporosis systemically by about 40%.
Okay, this all sounds pretty daunting. If our mouths can be this major source of systemic problems, we absolutely have to talk about prevention. Beyond just brushing and flossing better, what's the most fundamental defense?
It really comes down to diet. Our sources are crystal clear on this. Diet is absolutely crucial, not just for preventing cavities, obviously, but for maintaining the strength and integrity of your gums and the underlying bone.
So a bad diet fuels the fire, basically.
Exactly. It fuels the microbial growth and the inflammation. A good diet helps build your defenses.
Let's start with the basics then, cavities or dental caries. We all know sugar is bad, but what's the actual process? How does sugar wreck teeth?
It's all about acid. When you eat sugary or starchy foods, the bacteria living in your mouth feast on them. As they metabolize these carbs, they produce acids as a waste product.
Okay.
This acid causes the pH level in your mouth to plummet, typically below 5.5. And that pH level is the critical point where your tooth enamel starts to dissolve or demineralize.
So every time you eat sugar, you get an acid attack.
Pretty much. Now, if that acid attack happens maybe once or twice a day with meals, your saliva usually has enough time and buffering capacity to neutralize the acid and help remineralize the enamel.
Nice.
But if it happens repeatedly throughout the day, constant snacking, sipping sugary drinks, your mouth stays in that acidic danger zone for much longer periods. The enamel is under constant attack and doesn't get a chance to recover.
Which brings us to the really key point that people often miss. It's not just how much sugar you eat, but how often you eat it.
That is perhaps the single most actionable piece of dietary advice for oral health. Frequency is often a bigger driver of cavities than the total quantity consumed at one time.
Because each time you snack, you start a new acid attack.
Exactly. It takes roughly 30 minutes, sometimes longer, for your saliva to buffer the acid and bring the pH back up to safe levels after you'd eat sugar. If you're grazing or sipping constantly, you're basically keeping your teeth bathed in acid for hours on end.
Makes sense. Are there official guidelines on sugar intake related to this?
Yes. The World Health Organization recommends keeping intake of free sugars, that sugars added to foods, plus sugars naturally present in honey, syrups, and fruit juices, below 10% of your total daily energy intake.
Okay, less than 10%.
And they actually suggest that reducing it further to less than 5% provides additional health benefits, including for oral health.
Right. So reducing frequency and overall amount is key for cavities. But what about building that strong defense for our gums and bones, linking back to periodontal disease? What specific nutrients should we focus on?
Okay, think of it as assembling your dietary defense team. You need the building blocks and the support crew. First, the building blocks for structure: calcium and phosphorus.
The bone minerals.
Exactly. Essential for strong enamel and healthy jawbone. You find them in dairy products, leafy greens like kale and broccoli, almonds, tofu, fish with edible bones like sardines.
And I read somewhere that cheese is particularly good.
Yes. That's a great point from the sources. Cheese seems to have unique properties. It stimulates saliva and might even have some anti-cavity effects itself. It's considered karyostatic.
Okay, so calcium and phosphorus are the structure. What helps us use them?
That's where vitamin D comes in.
Hmm.
You need vitamin D to absorb calcium effectively. Good sources are fatty fish, like salmon and mackerel, egg yolks, and foods fortified with vitamin D, like milk or some cereals. Sunshine helps too, of course.
Got it. And what about protecting the gum tissue itself from inflammation and infection?
For that, vitamin C is absolutely vital. It's essential for collagen production, which keeps your gums strong and healthy. A deficiency can lead to bleeding gums and make them more susceptible to disease.
So load up on citrus fruits.
Citrus fruits are great, yes, but also bell peppers, especially red ones, strawberries, broccoli, kiwi, lots of good sources.
Okay, structure, absorption, gum health. What else? We often forget about the physical act of eating, right?
We do. Fiber and crunchy foods play a really important role. Things like apples, carrots, celery, nuts, even whole grains.
How do they help?
Two ways. First, chewing these firm, fibrous foods physically stimulates saliva production, and saliva is your mouth's natural defense system. It neutralizes acids, washes away food particles, and contains minerals to help remineralize teeth.
Nature's mouthwash.
Kind of.
Ah,
And second, the crunchy texture acts like a natural toothbrush, gently scrubbing the surfaces of your teeth as you chew.
simple but effective. And the last essential nutrient.
The simplest of all, water. Staying hydrated is crucial for saliva production. Plus, drinking water, especially after eating, helps rinse away food debris and acids. It's fundamental.
Okay, so calcium, phosphorus, vitamin D, vitamin C, fiber, water, a whole team effort.
It really is. A diet rich in these nutrients supports oral health from multiple angles, building resilience against both cavities and gum disease.
So let's try to tie this all together for everyone listening. If we circle back to where we started, the big takeaway here seems to be that taking care of your mouth isn't just some separate cosmetic task.
Yeah, not at all. It's an integral, absolutely foundational part of managing your overall systemic health. Protecting your mouth means you are actively managing your body's baseline level of inflammation.
And that baseline inflammation, as we've seen, has huge implications for your risk of developing heart disease, diabetes, potentially cancer, Alzheimer's. The list goes on. Eh?
It fundamentally shifts the perspective on something as simple as daily flossing. You're not just doing it for a clean feeling or to prevent bad breath.
You're doing it as a strategy for systemic risk reduction. We've laid out these consistent, often really significant links between periodontal disease and pretty much every major chronic disease process.
Indeed, we have. The associations are strong and repeatedly reported. But let's leave you with one final, maybe slightly provocative thought, turning back to the research itself.
Oh, what's a catch?
Well, it's not exactly a catch, but it's an important nuance. While these links between gum disease and systemic conditions like heart disease, cancer, Alzheimer's, while they are consistently reported as significant, often with quite high risk ratios, the quality of the research, specifically the systematic reviews and meta-analyses that pool all the data, is often rated as, well, suboptimal.
Suboptimal. What does that mean?
It means there might be issues with how the original studies were designed, conducted, or reported, which can affect the certainty of the conclusions drawn when you combine them all. One recent analysis we looked at actually rated the methodological quality of almost 72%, nearly three-quarters of the relevant review studies, as critically low.
72% rated critically low. So does that mean the links aren't real?
No, it doesn't disprove the association at all. The smoke is definitely there. But it means that establishing definitive causation, proving that the gum disease causes the systemic disease, beyond any shadow of a doubt, is still challenging based purely on the current, sometimes flawed, body of evidence. More high-quality research is needed.
Okay, that's a really important point of caution. So it raises a final question for you, the listener, doesn't it? Given how potentially severe these links are, even if the scientific proof isn't absolutely perfect yet, why is so much of this foundational evidence still needing improvement? And maybe more importantly, what are you going to do about your own oral health today?
Regardless of the final percentage points on causality,
Hmm.
are you going to take the steps to ensure your mouth doesn't become that hidden weak link in your overall health chain?
It definitely gives you something serious to think about next time you brush your teeth, a profound reason to pay attention.